Health officials from multiple countries, including the UK, are scrambling to trace passengers who left a cruise liner before the deadly hantavirus outbreak was confirmed. Singapore is now isolating and testing 2 people who were on the ship. Hantavirus typically spreads from rodents, but it's thought that in this case it may have passed between humans that were in close contact. About 150 people are still on board the liner. The MV Hondius left Argentina on the 1st of April. 10 days later, on the 11th of April, the first passenger died, a Dutchman who is suspected to have had the virus. The cruise ship continued on to the remote South Atlantic island of St Helena, where the wife of that man disembarked with his body. She then travelled to South Africa, where she later died. And we now know that 30 passengers in total left the ship, who also disembarked in St Helena. 7 are British, 6 are from the US, 3 from the Netherlands, 2 from Canada, Switzerland and Turkey, and 1 case each from Germany, Denmark, New Zealand, Singapore, Sweden and the Caribbean island of St Kitts and Nevis. We already know about 2 British people as well who are self-isolating at home and flew back to the UK. Now, neither had symptoms, but contacted authorities when they heard about the ship's cases. And the cruise ship has then continued its trip, dropping anchor off the coast of Cape Verde on the 3rd of May. We can show you the current position of the liner. The remaining passengers and crew are now sailing to the Canary Islands, where they could be allowed to disembark on Saturday if they don't appear to have symptoms. Guy Hitchcoe is our correspondent in the Canaries and Tenerife, and he says it's still unclear as to how and where some passengers will be quarantined once they reach the islands.
Well, it's still unclear exactly when the ship will arrive. We're told it would take 3 to 4 days. It could be either Saturday or possibly Sunday, according to some reports. So that's still unclear. I think it might depend a bit on the weather during the journey. But we do know that there are members of staff from the World Health Organization on board, along with infectious disease experts who are carrying out assessments of the passengers as they travel. When they do arrive here at the weekend, they will be assessed again. And we're told that there will be no contact between the passengers from the boat and local people here. That they will be assessed, and then a decision will be made in terms of whether they can be immediately repatriated to their countries. Remember, these are passengers from 23 different countries on board the ship, or whether they have to stay and undergo some kind of treatment. There are 14 Spaniards on board. We're told that they will be taken to a hospital in Madrid. There's some slightly confusing information in terms of how they will be handled, because one ministry's talked about them undergoing a voluntary quarantine. Another ministry said it would be an obligatory quarantine for those Spaniards when they arrive. But I think we'll hear more about the details in terms of exactly how this situation will be handled nearer the time, either on Saturday or Sunday.
Thomas Hoffman is the head of emergency preparedness and response at the European Centre for Disease Prevention and Control, joining us now from Stockholm. Thomas, very good to have you with us. We are told that this is a rare event, but that the risk to the public is low, even negligible. So I wonder at the moment, what are your concerns?
Yeah, our concerns are mainly right now to really get procedures in place for the safe disembarkation of the passengers. We're working intensively now with the affected member states, with partners, with the World Health Organization to set up procedures which are suitable for this situation.
Is there an issue around the long incubation period of this virus? Does that complicate, surely it does, all of the tracing, contact tracing that's taking place?
Surely it does, although there's still, we know from science that in most cases, incubation period still is around 3 weeks. So, of course, I think anyone needs to stay vigilant afterwards. But I think we still have the majority of cases having a clearly defined incubation period.
But is there a concern that this can be spread, that there can be an airborne spread of this?
No, this strain of hantavirus cannot spread airborne. I mean, it's not a respiratory disease like we know COVID or influenza. Also, it can, I mean, it's very rare at all that it transmits from human to human. Hantavirus normally only transmits from infected rodents to humans. But in this situation, yes, human-to-human transmission occurred as people had close contacts on sailing 5 weeks on a cruise ship.
Thomas, we're seeing pictures of some people being taken off the ship, and everyone there is wearing what looks like some kind of Hamza suit or protective gear. What is it that needs to happen to make sure that those people are safe? What are the measures that are taking place?
What we recommend in our risk assessment, which we published yesterday, is that people should wear masks, regular face masks, and of course, in clinical care, people should consider wearing FFP2 masks. But as said, it's really like not a respiratory disease which does transmit so easily. So regular precautions are sufficient and recommended at this point in time.
And just a final message from you, Thomas, to the public, to those that are watching and listening at the moment, about the risk to the general public at the moment.
Yeah, the risk to the general public is very low, as we stated also in our risk assessment. And it's again because, first of all, the rodent is not present in Europe, where the hantavirus usually gets infected or transmitted to humans. Then human-to-human transmission only occurs under very close contacts. Health authorities and passengers are informed for contact tracing, for follow-up. So we know that if this is handled within those procedures, the risk remains very low.
That is reassuring. Thomas Hoffmann, thank you very much for joining us.